Welcome to the Royal Aberdeen Children's Hospital. Where every year...
Option number one is chop it off.
more than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie City and Casualty and what you actually see in the soaps.
Coming up, Miss Clark faces a challenging surgery on a newborn baby.
Could you roll her towards me, please? There's the cyst. Morning. Hello.
Will paediatric oncologist Fiona get her dream job?
I don't quite know what to expect.
And 4-year-old Summer undergoes a life-changing operation.
Hopefully I'll try and get her up on her feet and walking.
This is the Children's Hospital. For most children, hospital visits are a rare occurrence. But for those living with lifelong conditions, frequent trips are part of everyday life.
Hello!
Like 4.5-year-old Summer, who's travelled from Shetland with her mum and dad for her 5th operation at the hospital.
I'll let you see it anyway, and you can see what you think.
Summer was born with a condition called arthrogryposis. Her orthopaedic surgeon, Miss Mills, has known her for most of her life.
Summer is a very complex young lady. She was born with a lot of her joints in a very stiff and abnormal position. When I saw her, she was only a few days old and her feet were almost behind her head, so she was born sort of folded in half. And ever since she was born, she spent a long time in hospital.
Arthrogryposis can result in tight, restricted joints and muscle weakness.
We have noticed over the last 2 years is that her feet are tending to turn in more and more, so that her toes are almost touching each other. And a lot of that's coming from her shin bones, her tibia, which are twisting. It's called torsion. The aim is to cut the bone, turn the bone, and fix it again. The plan tomorrow is to try and straighten her legs, which will help her in her standing frame and help her sitting in a buggy and help her feet so she's not tripping on them.
Do you want a drink? Okay.
I'll see you tomorrow.
The following day, Summer's mum and dad are preparing themselves for the operation and the impact it will have on their lives.
Can you say hi?
Just very anxious. There's that much going on with Summer all at the same time.
I'm actually more worried about having casts on for 8 weeks. She's going to hate it, and she's very active and she likes bare feet and she likes bare legs, and they're going to be very restrictive. She already can't do a lot and this is just going to make it much harder for her.
Hopefully I'll make a difference and we'll try and get her up on her feet and hopefully in the next few years.
But before the operation can go ahead, Miss Mills has to clearly identify which limbs are to be operated on.
Now, do you want arrows or smiley faces? Smiley faces?
Tortoises.
You like, oh no. Can we draw a tortoise? Well, I can draw a round thing with 4 legs. Can we give that a go?
It's going to look like a terrapin, I think, rather than the tortoise. Not doing so well on this leg. Put the tail at this end, shall we? There we go.
Oh, wow.
Not quite as good. Alright, now I'll see you later. I'll let you know how we get on.
Okay, thank you.
Although the operation should be straightforward, there are concerns about anaesthetising Summer.
Summer's quite complicated.
Consultant paediatric anaesthetist Kay briefs the team about the challenges.
My main problem is that she can't open her mouth very well. She can less than a finger breadth opening. If I can't get the tube in, I don't think
Absolutely
we can
fine.
safely do a
So
procedure.
I've made it absolutely clear that
Yeah.
we may not
do this.
Yeah.
And they're absolutely fine with it. And they're anxious about her anaesthetic.
Yes. Yeah.
Right, let's get Australia on the route.
Just wait till she's nice and settled, then we'll get her across. Get her across. Super. Perfect. Thanks so much. Right, let's go.
As predicted, Summer's anaesthetic is not straightforward.
Suction as well. So that's the mask here that it's turned on. That's either the only way that you can see that she's breathing is visually. So you need to keep an eye out. Very limited mouth opening.
Summer's arthrogryposis restricts how wide she can open her mouth. Kay has to put the ventilation tube through Summer's nose.
And you get a stethoscope and we just listen to both lungs.
It takes over an hour for Kay and her team to safely anaesthetise Summer.
We don't do this sort of thing every day, so it always causes a little bit of anxiety. But Summer is a complicated case, but you need challenges. It makes the job interesting as well and very satisfying.
In audiology, 3-month-old Cameron has been brought in by Mum and Dad. He has hearing loss, which was picked up when he was just a few weeks old.
He can hear, but what the concern is he won't be getting full access to all the speech sounds, so we're wanting to give him that so there's not going to be impact longer term on his speech and language development.
Cameron's appointment is with audiologist Gordon.
OK, Cameron, I'd like to come through. Just into the usual room there. Yep, just we'll always be into that room.
Okay,
He came in 3 or 4 weeks ago for the hearing test and we're told that he had a bit of hearing loss. And we just thought it'd be fine. Because he jumps when the dog barks, the doorbell rings, so we didn't think there was going to be a problem. So it was a bit of a shock when I first heard. I did get a bit upset.
Today, Cameron is getting his first hearing aids.
I just keep thinking it's a lot like getting glasses if you can't see properly.
Currently 3 different colours of hearing aid. We've got silver, black, or the more traditional beige.
What do you want, Cameron? Don't know, what do you think?
I think the silver. Silver
Yeah.
looks smart, doesn't it?
You're full of chat, Cameron, aren't you?
I know, you're really chatty today.
We'll see about getting these fitted.
The hearing aids have processors which will cut down background noise and amplify speech.
So is that them both on?
That's them both on.
Oh.
What do you think of that then?
There we go. Can you hear better now? Can you hear Mummy's voice clearer? Eh? Hey.
We often don't get a reaction
that-
sort of with us when they switch them on, but I mean he has got a wee look of
Oh.
wonderment as to, well, what's
wow,
going on
what's
here?
this? Can you hear better? Is that why we're getting smiles?
I think there was a bit of a kind of, the eyes went wide. There was definitely an eyes went wide and then I think it took him a second and we got a bit more of a smile.
Until Cameron can fit his own hearing aids, Mum and Dad must learn how to do it for him.
Right, okay, come here, wee man. You're going to wriggle about now, aren't you? Make this awkward for Mum to do.
It's never easy for Mum.
Yes, I know. It'd probably be easier if we lay you down a little bit. Oh, I know. Is that it?
Yeah, I think so.
There you go.
There you go.
You go to Daddy now, Mum's done that. Mum's been the cruel one.
Oh, you're smiling now.
You don't need this then.
Are you smiling? Is that better?
I think as his ears are so little, I think it'll take a bit of practice to get it. It's a new thing for him. He's not used to having us poking around in his ears and putting something in them. But now he just seems, well, you can see, completely content and giggling.
Although fitting hearing aids on small babies is far from easy, it's important for Cameron's future speech and language development.
The brain needs the sound stimulation if it's going to form the appropriate connections and develop appropriately. Getting that now is really important for Cameron.
As well as having frequent moulds taken to ensure his hearing aids fit him as he grows, Cameron will be back for regular hearing tests.
We'll see Cameron from now up till he's a young man. We do form relationships with the families because we're with them right through his education, so the next 16, 17 years they'll be coming back.
Tired him out. No, that's perfect.
Okay,
Thanks
fantastic.
very much.
Okay, see you later.
Bye.
Hi, I've got to come down for his MRI.
6-year-old Leo has a rare autoimmune disease which caused lesions to develop on his bones.
So we are going to go further in.
He's a frequent patient at the hospital. Just 4 days ago, he was here for a scan to check the progress of his bone lesions. Today, he's back for another examination because some of the medicines he's taking have side effects and can damage eyesight.
Leo, high five, how you doing? Good.
Today, he's seeing consultant ophthalmologist Mr. Reddy.
Wow, look at this room. He's been on some medications that can cause problems with the eyes. So we're going to check out and see if he's had any side effects of the medications. So what I'm going to do is I'll try and do some simple tests to see if the color vision is affected, and I'll check his pupils and also look at the back of the eye.
Okay.
Would that be okay with you?
Yeah, that's fine, yeah.
Yeah. Okay. So what number is that?
12.
Wow, you know your numbers. Good. What's that?
8, 6, 1,
1 and
5.
good. High five again. Good. He did fantastic.
Satisfied colour vision is normal, Mr. Reddy now needs to examine the back of Leo's eyes, but he needs some drops first.
But cold and tickly, okay, Leo? One up. Good boy. Good boy.
The medications he's using is related to some toxicity of the optic nerve. The chances are quite rare, but it's still worth checking. So we need to get your chin over there. Let's have a look at the. I can see some chocolate on your lips there. Did you? Let me have a quick look at the back of the eye. Look at my left ear over here. That's very nice. Okay, good. Okay, sit back now. That's all done. You did so well. We've got all the tests done, and there is no hint of any toxicity of the medications he's been on. Okay, that's fantastic. So if you stop the medication and there's no plan to restart it, there is no need to see him back again here.
Okay. Now I can come back and play.
Now we can go home.
Hi, Leo.
Morning. How are you?
Paediatric oncologist Dr. Fiona looks after children with cancer and leukemia.
I grew up in Stonehaven, so local to Aberdeen, and I went away for university and my early medical training, and it has been lovely to come back to my roots and where my family are from.
Today is one of the most important in her career. She has an interview for a permanent consultant post.
At the moment I'm here as a locum, which means I'm on a temporary contract, but I'm hoping to change that.
But first, she has her morning rounds on the medical ward.
You don't quite know what you're ever going to get when you come down in the morning. You could be dealing with somebody who's quite septic with a complication of treatment, or you could be dealing with a problem with how the chemo's been running, or if it's leaked, or they could be very well. Most children that we look after have a life-threatening diagnosis, so if we didn't carry out any treatment, then most of them, their underlying cancer diagnosis would prove ultimately to be fatal. However, with treatment in the UK at the moment, 85% of children with cancer will survive long term. Our work is really important because we can dramatically transform the outcome for these children.
I need like lots of black for all the books.
Well, hopefully the lady will bring some colouring pens now.
Fiona's first patient is 8-year-old Violet.
How are you feeling today?
Good.
Is this a new toy?
I got it from one of my friends.
That's really cool. So, any problems at all since yesterday?
No.
No? So not feeling sick?
No.
Managed to eat some food?
Yeah, I almost did.
Well done, that's pretty good. And any pains anywhere?
No.
No? You make my life too easy, don't you? Anything Mum's worried about?
I don't think so. No, she's good. She's doing really well and pleased this time.
Yeah, you've been a real trooper so far. I think you find the bit being stuck in this room a bit hard, don't you? So, yeah. Yeah, it's a long day, so. Good, well done. We'll see you later. Thank you. So the next patient we're going to see is Holly. Holly is coming up to her 2nd birthday and she's got a tumour which compresses her bladder. So she's having chemotherapy for that and her tumour's shrinking. But she's been in with a significant side effect in that she's having high temperatures and kind of been unwell. We don't completely know where her temperatures are coming from. She did have a croupy illness and needed some steroids for croup a few days ago, but that seemed to have settled. Good morning. Hello. Oh, she's hiding. How's Holly this morning?
Not bad.
No, we just had a temperature at 6 o'clock. Look at these slippers. Just have a listen to Holly's lungs again. Seeing the patients and interacting with them and their families is a very good distraction rather than sitting in my office getting more and more nervous. Ironically, doctors don't do a lot of interviews, so this would be my first really serious job interview. Yeah, I don't quite know what to expect.
Fiona is being interviewed by a panel of 10 people, a mix of doctors and hospital managers.
I think it was a fair interview. There's always things that you think you could do better, and a few questions where I think, oh, did I waffle a little bit, didn't quite answer the question, but in general, I think it went okay. However, I am an hour late for a clinic that I'm meant to be doing this afternoon, so I am going to go down, join my colleagues, and then somebody will come down and feed back to me when they've made their decision.
It doesn't take the interview panel long to come to their decision. Fiona's colleague, Dr. Bishop, has the job of giving her the news.
Hello. Hiya. So, Fiona, congratulations. You did fantastically well in your interview. The panel were all uniformly impressed by all of your answers, and the chair particularly asked me to pass on how impressed she was and how grateful she was for your time and for applying for the post. So, congratulations. Welcome to the team. So, excellent.
Thank you. Getting the job is important, but actually what's important to me is doing the job and doing the job well. You're on the move this morning. I'm looking forward to 20, 30 years of doing a good job.
In the operating theatre, orthopaedic surgeon Miss Mills is about to begin Summer's operation.
So hopefully this is a one-off procedure. That's the aim. But because she has developed the deformity so young, there's a chance that it will recur and she might need the same procedure again. And her parents are aware that that's one of the issues with this. You can turn 90 degrees slightly, twist her that way. That's going to be able to stay still in the pattern.
To fix the twist in Summer's legs, Miss Mills must break the bones in her shins.
It will be that larger saw blade. And a picture there, please.
Wires need to be inserted to keep the bones straight while they heal.
Okay, the K-wire, would that be okay, please?
Fitting them requires very precise adjustments.
Now, her hips don't move particularly well. Okay, right. Yeah. Thank you very much. So that's the left side done.
Consultant paediatric anaesthetist Kay keeps a close eye on Summer throughout the hour-long operation.
So I back your wire out to the entry point. Hold it there at the point where it enters the bone and get a picture. And then...
Make sure that.
So far, doing well. I think we've got pretty good correction. We've corrected her as much as we can because her tissues are so stiff. It's been a bit of a challenge, but I think certainly her feet are pointing in a much more satisfying way out rather than in tone, which is what she was.
With plaster casts fitted to hold the legs in place, it's time for Kay to wake Summer.
Summer, hello. Excellent. Well done, Summer. Good girl.
She will go back to the ward to be reunited with Mum and Dad.
Nice big blanket. Cozy, cozy.
Baby Isabel was born 3 days ago at the nearby maternity hospital. She has an ovarian cyst.
It's about 8 centimetres in diameter, and it's pushing all her organs here, there and everywhere. She's been having trouble feeding, trouble breathing, but we didn't really realise how bad it was going to be.
Taking care of Isabel today is consultant paediatric surgeon Miss Clark.
The cyst is obstructing the flow of stuff down her bowel, and that's why she's had that green vomit, which is not what we want to see.
Ovarian cysts are not uncommon in baby girls and often disappear over time. But Isabel's requires early intervention.
The size of her cyst, it's got a potential to twist, and if things twist, that's when the organs can get damaged. We think they happen because of the influence of the maternal hormones, so maternal estrogen, on the baby's ovarian tissue whilst they're in the womb there, because obviously they're bathed in mum's hormones. This affects them and can make a cyst in the same way it can make a cyst later on in life as well.
I'll give you a shout later, okay?
Perfect, thank you very much.
Okay. All right, she's in good hands. All right.
The plan is to drain the cyst using keyhole surgery. It's minimally invasive, but in newborn babies, it can be challenging.
With keyhole surgery, you rely on creating a space. In a baby's abdomen, it's very small, and so you've got a small working space anyway, but when you've got a big cyst filling half of that, the amount of room you've got to see things obviously is much smaller. Hey, we'll keep you warm, little one. Okay to start?
Yes, thank you.
Miss Clark makes an incision for the laparoscope, which will enable her to see inside Isabel's abdomen.
Okay, clip again, thanks. Let's see what we can see. There's a cyst. Okay, we're getting some fluid. That's still coming or not?
Yeah, it's coming.
Cool.
Yeah, that's it.
What are you up to now?
120.
120. So the advantage of doing it under vision is that we can see, you know, which bits are the bits where there's more fluid to get out.
Getting the last fluid out of the cyst requires some careful adjustments.
Could you roll her towards me, please? So if I come in and I can pick it up from this side. Can you aspirate there for me, please? That's it. Perfect.
A little bit nervous, but it's hard to put into words, to be honest. You hear all the stories about how being a father changes you, and yeah, your life will completely get turned upside down, and yeah, I've experienced that already, and I'm sure I've got much more to go.
I'm happy that we've got it drained, we've got it drained fully, and so what we'll do is then just scan her again in a few weeks' time and see what's happening. And hopefully, it won't recollect.
Not a care in the world.
I know.
2 weeks after her leg operation, Summer is back to have her wounds checked and new casts fitted by orthopaedic practitioner Andy.
She was actually down in the neonatal unit. We started casting her, so I do know, and obviously know the parents as well. Okie doke, missus. Hurry up, where are you going?
Hey, tried to escape already.
Obviously the plan of attack is we'll take the cast off, have a quick look at the wounds, give it a nice clean, new cast on. Are you ready? Here we go.
Well used to you. Wow.
Not bothered at all, are you?
Right.
I'll be chasing you around.
Oh my goodness.
Was it 2 weeks ago?
Yeah, it is, Andy, yeah.
That's it, that's it.
Everything's fine.
So I'm just going to get a little clean, okay?
Sure.
It's a bit of a shocker, really, isn't it?
Seeing Summer's wounds for the first time is a sobering moment for Dad, Brian.
Whew. Very emotional. I suppose what's going through my mind is, what does it feel like? Also, what's going through my mind is, will she remember any of this? You know, hope she won't. You just wish you could do, you would just do anything to make things better for her, you know. Oh, you're doing so well.
Yes, Summer, how are you doing?
For orthopaedic surgeon Miss Mills, it's also her first chance to see Summer's legs.
How are they looking?
Good, really good.
That's a huge difference, isn't it?
So we'll do this bit first red, then a bit more red, and then we'll go for the green and the special glitter.
Christmas is only a few weeks away.
Shall we sprinkle of green now?
So Andy opts for a festive themed cast.
Right, that's one done. Here we go.
Wow. Want to see what's going on?
There you go.
Look at that.
Nice and cosy.
Wow.
Summer will be back in 2 weeks to have the wires removed. New casts will be fitted and changed regularly until the team are satisfied her legs have fully healed.
See you later, mate.